The Farming Community Network in Northern Ireland launched its Nip It in the Bud campaign to help promote early detection of cancer.
For farmers and people living in rural areas, the impacts of cancer can be especially devastating. We all know that there can still be a tough as old boots attitude out there, the mindset in our farming and rural communities, and we need to change that mindset.
Katrina Crawford is the Farming Community Network Northern Ireland manager. Katrina, nip it in the bud, of course, is a very telling phrase. Expand on that a little, if you will.
Yeah, so the nip it in the bud, as you said, it is very recognisable, and it really is just about getting that message across to of early cancer awareness. So if you notice an issue or a problem, to get your GP, don't leave it, don't delay, and it really does reinforce that message that early detection is so important when it comes to cancer. It does save lives. It is a huge difference in the person's quality of life as well, so it does impact what treatment they'll have down the line as well. So it really is that kind of holistic approach to surviving really cancer and living with it.
So Katrina, the really important thing is, where can we find out more?
Yes, so on our FCN website we have a page dedicated to the project, so all our information is on that, and myself and George, my colleague's contact details will be there as well.
Turning now to Dr. Ethna McFerrin, cancer health economist, I want to ask you, Ethna, why this event today was so important?
I think for all of us, early diagnosis is really important. We have a number of screening programmes available in Northern Ireland, chiefly amongst our rural communities, since we know that the average age of farmers is around 59. I would prioritise the colorectal cancer screening programme. It's currently offered between the ages of 60 and 74, but we're one of the last areas in Europe and in the UK to expand our screening programme. Ideally, we would be offering cancer screening at the age of 50 and certainly at least at 55. We know that whenever cancers are diagnosed at an earlier stage, that 99% of cancers have a 5-year survival when diagnosed at early stage through screening. Unfortunately, in Northern Ireland, where we currently stand, is that around 27-28% of our colorectal cancers are actually diagnosed as emergency presentations, and the survival significantly diminishes down into the 30-odd%. So for me, driving home that message for rural communities that participation in screening will improve survival and outcomes, and to our department and ministers that we need to significantly expand screening to offer that opportunity for improved survival to our communities is really important.
So for you, bowel screening is so important and should be open to a wider section of the population. Why is that not happening now?
I think currently we understand that there's wait lists for our red flag referral clinics, and there's that trade-off. When we need to expand screening, we need to have a greater capacity, or we risk the impact there on the later stage red flag capacity. So it is that trade-off, and so for me, we've been working with the bowel screening programme, doing health economic modelling in the background to understand the extent to which we need to expand capacity, but also the extent to which we can make small changes to incrementally expand out our screening ages within the available capacity that we have.
So is it a capacity problem, or is it an economic problem, or is it a political problem, a lack of political will?
It's a combination of all of those. I wouldn't say there's a lack of political will. Certainly the Minister has indicated that he is open to the expansion of the screening programme. I think on the ground we know that in order to deliver that we would have to significantly increase the capacity, and without additional training and additional staff on the ground we simply can't offer those tests without the risk of a delay, and we know that where there's a delay in diagnosis that increases people's concerns and worries as we go along. So it is that small titrated steps of expanding all along, but at the core of that does come funding. We know that it's probably somewhere in the region of 1.5 million to expand out the screening offering, but we know that offering earlier interventions in the long term will be a more cost effective approach than what we currently adopt. And additional work that we had conducted in evaluations of the end of life care, we also know that around 5 million of our unscheduled care use is attributable to patients who are dying with a colorectal cancer. So we know that there are opportunities for us if we were to downstage or to diagnose people at an earlier stage, that not only would we save in the longer term in relation to the improvements in survival and the reductions in the treatment costs, but we would also save in the demand for unscheduled care and the significant costs that has, as well as the demand in our services.
And prevention and early detection is far cheaper and far more effective than late detection.
So a fit kit that is offered, or the Q-Fit test that's offered in the screening programme, costs somewhere in the region of £5 to £8. We know that a colonoscopy, for example, is significantly more expensive, and the treatment for bowel cancers go into the thousands. So if you can do a test that's £5 to £8 and have that done on at an earlier point, and have a smaller, surgical intervention rather than a treatment, the cost savings accrue. So I always consider screening as a low interest mortgage on the future of cancer prevention. That's my perspective on this, and I think it's borne out by the evidence internationally.
I've been over here a couple of times now, and I always keep saying, I was saying to the Health Minister earlier about the Northern Healthcare Trust, about what they've been doing. And what I'm really keen to take from Northern Ireland is some of the lessons that have been learned and the work that has been done into other areas. So that's the reason why I'm really passionate about it, because I'm a big believer in we should be taking lessons and we should be making a difference.
Anton, thanks very much for coming here today to Northern Ireland and for enabling this process to happen. Why is it so important to Macmillan?
It's really important to Macmillan because what we've realised and identified throughout all of our work is health inequalities. And actually part of that has identified rural communities in itself. And rural communities isn't just our farmers, it's a big part of our farmers, but it's also rural communities in itself, so people that are living in villages or not necessarily in urbanised areas. But also part of this programme is also to look at migrant workers as well and the support that they need to get. We also know that people living with cancer from within those rural communities are less likely to go to the GP, and with this whole programme is about encouraging people to seek support early on.
And how do we do that in real terms? When people are reluctant to go for support, how do we encourage them?
We make it easy. We need to make things really easy. Today, people were talking about information and support. It's vital that we get information and support in places where people will accept it and will take it. And when I say take it, I mean discreetly take it. Not a huge, great big poster, but maybe some cards with people in people's languages, or also in different imagery as well. So some of the posters that we've looked at today have got real good images that enable people to look at the image, think it's something else, and then go and read the information and take that information away for them to digest at home. But also we need to think about the generational gap. We would like some of our younger farmers and people that are living in the community that are younger to take that literature, give it to their mums and dads, nans and granddads, to encourage them to go and seek support wherever possible.
Approximately 36% of our population here live in rural areas, and this can create unique challenges for accessing services and support. With our migrant workers, a valuable community, particularly in our agri-food sector here in Northern Ireland, they are often facing additional challenges and barriers.
With the new strategy, a big focus of ours is around inequity and inequalities, and we know that in rural communities they face those issues day in, day out.
Okay, and one of the fascinating things for me was you came up with a phrase that may well become a strapline of the future, which is, Granny does need to know. Can you explain the background to that?
Absolutely. Growing up in a farming family, when I was little, there was things that happened on the farm, and my granddad would have witnessed it, and he would have said, Sarah, Granny doesn't need to know about this, because he knew that he'd get it, a wee bit of a nag in the ear from Granny when she hears that Sarah ended up underneath the bull and he had to rescue me, or that the chainsaw was being used above my head. But there are times that Granny does need to know. When a family member takes a wee turn, or you just notice that something isn't right, there are times, because it usually is the grannies in the family who make things happen, who get those doctor's appointments, who get people to go and see about something that they're just a wee bit concerned about.
Macmillan teams work tirelessly to provide emotional, financial support, community support and information to help to better understand what cancer diagnosis really means for them.
Tracy Doherty, you're with Farming Community Network, and you're also the wife of a long-term cancer patient.
Yes, that's correct.
How has that process been for the pair of you?
It's extremely difficult, to be honest. I sometimes refer to our population of people, i.e. the wives, the husbands, the loved ones, as the suffer in silence population. We're there, we watch it happening. We do suffer in silence because we don't want them to see us being upset by the pain they're going through and the suffering and the not knowing really at the end of it how it's going to go. So we want them to think that we're doing well, which we try to do for them to try and keep them on a high. The thing is, we do hit a low at times, and sometimes it's good to talk to other people who are in a similar position as ourselves. And that's the thing about rural communities in particular and farming communities. We really are encouraging the likes of partners, wives, husbands, whatever the case might be, to come to their husbands or wives and say to them, look, I'm not happy about a condition that you've been complaining about recently or the lump that you have. I really, really want you to go and see about it, because you've got to think of me, i.e. your wife, you've got to think of your children, and that's the most important thing.
One of the wonderful aspects is the fact that you prompted early diagnosis in your husband's case. Tell us about that.
Well, it was one of those things. My husband had a history within his family of cancer, and when he presented with symptoms, and these symptoms kept going on and not going away, we always expect the common colds and the flus to disappear, but when that doesn't happen, perhaps people should be thinking of something else, and that's exactly what I thought of. I thought, with the family history, maybe it's something that should be looked into a little bit further, and all it takes sometimes is a blood test or just going to your doctor and having a general chat with your doctor about it. Let's be honest, they are the professionals and they're the people that can diagnose very, very quickly. And early diagnosis is so important. My husband is living proof of that. He's here to talk about it today, and it was in the early 2000s he was first diagnosed, so we have had a long and very happy life together.
How do you manage, both of you, to say, well, we're going for chemo again? How do you cope with that?
It's not easy. It's a difficult road to go along. I can't say it's easy, because it's not, but you will get there. You will get there. And for someone who says, you know, I have farming things to do, I have other important things to do, there is nothing more important than your family. And that's something that you really have to put to the foremost of your mind. Do I want to be here in 10 years, 15, 20 years for my family and watch them grow up? And if the answer is yes to that, then you go to your doctor and you get early diagnosis, and hopefully you can live a long, healthy life after that. I suppose really it's just a case of knowing that behind every patient there is a very long-suffering family. Let it be children, let it be the partner, mothers, fathers, just a loved one is there, and those people sometimes just need an arm on their shoulder to be told, look, we know that you are going through this too, and we're there for you. If you want to go for a coffee, we're there for you. It's just so that they also know that they're not the forgotten people, because it can be a very, very long, dark road for families of those that are going through cancer treatment.
The Farming Community Network event today was a very, very successful one. It highlighted a number of issues, not least of which was that early detection of cancer leads to survival of at least 90% of the people whose symptoms are detected early, and less than 30% of those whose symptoms are detected late have that same chance of recovery. So if you're in any doubt at all about any symptoms that you're experiencing, please contact your GP. Failing that, please look this information up on the Farming Community Network website.